Hi, and welcome to this how-to video on how to use an IFC machine and ambulate using 2 crutches. My name is Megan, and I'm an OTA PTA student from Georgian College, and I have my colleague here, Megan, who will be playing our client today, who is 20-year-old Jeff, who just had ACL reconstruction on the right knee. Jeff has chronic pain, therefore we are using the ICF machine in order to alleviate his chronic pain. So ICF stands for interferential current. So basically it sends current into the skin and creates a muscle contraction for chronic pain. And creating that muscle contraction allows for the endorphins in your brain to be released. The endorphins are feel-good hormones. That's why your pain is alleviated after using the IFC machine. So the first thing that you want to do is get your client set up in a comfortable position. And then you want to explain to them what they're going to feel and how this is going to work. So the client for chronic pain should feel like a thumpy, kind of twitchy muscle contraction feeling. And you want to go through a set of tests before you start the IFC machine. So the first test that you want to do is a light touch, just to make sure that there's sensation in the leg that you're going to be putting the IFC machine on. So you just take 2 fingers and lightly go over the area that is to be applied for the IFC, and you ask the client if they feel the same or different. The next test that you would do is a hot and cold test. So you would take a test tube with hot water and a test tube with cold water, and you would let the client know what it feels like on their unaffected leg. So that's hot and that's cold, and once they know what that feels like, you can go to the affected leg and you ask them to close their eyes, and you put hot and cold so that you know if they have intact sensation or not. Once you know that their sensation is intact, that's very important for IFC, as IFC relies on the client telling you whether or not they can feel that muscle contraction. Okay, so the next thing that you need to do before you start your IFC treatment is you need to ask your client if they have any contraindications or precautions. So as long as the client has no contraindications and you're keeping in mind those precautions, you're able to start your IFC treatment. So the first thing that you want to do is get your client set up. IFC is quadrupolar, indicating that there's 2 leads and 4 electrodes. So the black pieces are the electrodes and the wires are the leads. You want it set up in an X formation, alternating across from one another in order to have that current meet in the middle and produce a low current, which is what we want for IFC. So the next thing that you would do, and you also want the electrodes covered in ultrasound gel. You want to make sure the whole electrode pad is covered. So the next thing that you would do is set up the IFC machine parameters. So you can use this set button to go through all of the parameters. So the first one is single. So you would hit set because we have a single patient. We want it on interferential current. We want our treatment time anywhere between 10 and 20 minutes, and you can use this dial to change it. So you would hit set. We don't use surge time for IFC, and you want a sweep range. So that's indicating the range that the current will deviate to. So you can you just move the dial and that moves it over. So there are preset ones, or you can select. So you select an upper limit. For chronic pain, it is 10. And you would hit set, and for lower, it is 1. And it should go back and forth telling you what your sweep range is. For this one here, you always want a 4-pole because you have 4 leads, 2 leads. And you don't need anything to do with the frequency, so you can just leave it flashing on that last one. So once the client is set up, you will hit the start button and you will turn the intensity up until you get a muscle contraction and the client is able to feel that and they're still comfortable. So once your client has been there, you would give them a bell, you would leave for 5 to 10 minutes, come back, checking on their skin, make sure that there's no adverse reactions going on and that your client hasn't accommodated to the settings that you have. So you're always checking in with your client, and then you can leave for the rest of the 10 minutes and come back when it's time. And it's important to give your client that bell so that they can get a hold of you. So once your treatment has finished, you just stop the treatment, you can turn off the IFC machine, and you get your client cleaned up.
Okay, hi, my name is Megan. I'm an OTA PTA student at Georgian College. Today we're going to be working with Tracy, who is our client Jess, and she had an ACL repair, or he had an ACL repair. And so we're going to be teaching him ambulation with the crutches, but first we have to fit him for the crutches, so if you wouldn't mind just lowering your arms, keeping that perfect. And then you want to make sure it's at his wrist crease, you want to make sure that there's 3 fingers being able to be put in here, so those crutches fit you good. So now we can teach you the proper step 2 pattern that you're going to be using, and your weight bearing status before we go is weight bearing is tolerated, meaning you can put as much weight as you can through that step, okay? And I'm going to be standing here because he's supervision, so I'm close to him. Alright, so first you're going to do your crutches first, and they're going to go forward. Perfect. And then your bad leg. And then your good leg. So just notice that you're kind of hesitant to put a lot of weight through it, so just reminding you that your weight bearing is tolerated, okay? So let's try that one more time. So you have crutches, bad leg, crutches, bad leg, good leg, perfect. Crutches, bad leg, good leg. So, in this video, we taught her weight bearing status, we taught her her ambulation and how to move with her crutches in the step 2 pattern. So in this video, we learned how to use the IFC machine. We also learned how to use crutches with a weight bearing tolerated step 2 pattern. We hope this video was informative. Thank you so much for watching.